The article in Trends on men and the metabolic syndrome, I hope will be enhanced by listening to this short video clip. We've learned a lot over the last couple of years about the importance of the metabolic syndrome, and this is combined with the fact that more and more men that we see are overweight. The key thing is that weight is mainly centered within the abdomen, and abdominal fat is very metabolically active. It produces cytokines, it produces increased levels of leptin, both of which tend to switch off LH in the pituitary, which leads to hypogonadism because the testes is not stimulated. It produces high levels of insulin because these men become insulin resistant. Now, insulin causes sodium retention, which pushes up the blood pressure, and IGF, a growth factor, which drives prostate growth. So these men can be told that if they lose weight, they have two things to gain. Their blood pressure will come down and their prostate will stop growing. And that could be a major incentive in trying to encourage these men to improve their lifestyles and lose weight. Low testosterone, of course, is a compounding issue because with a low testosterone, these men lose their drive and they're less motivated to lose the weight. And sometimes a course of testosterone therapy can just get them started by encouraging them to exercise more, and they will see their weight come off. Nevertheless, if they can lose weight and take exercise, that alone will push up the testosterone level on its own. So for me, testosterone therapy is not the first thing I do. The first thing I do is explain to them why they need to lose weight and take exercise. Mediterranean diet is what's recommended. There's very good evidence base for that. And the advice is to eat plenty of fresh fruit, vegetable salads and fish, keeping away from cakes, pies, pastries, puddings, concentrated dairy products, red meat and sweets. This diet should be combined with a twice daily exercise program. 30 minutes of exercise increases insulin sensitivity for about 15 hours, hence the need to do it twice a day. A brisk walk is enough. It doesn't need to be going to the gym or doing anything violent. Simple aerobic exercise for 20 minutes, and ideally about 10 minutes of resistance exercise is the most effective at increasing insulin sensitivity. A walk in the morning and a walk in the evening combined with the Mediterranean diet. This could make a big impact on the future risk of cardiovascular disease, because the other aspect of this is that these men have a raised blood glucose because they have pre-diabetes. They have an abnormal lipid profile with a suppressed HDL and a raised LDL cholesterol, and they have hypertension. So you have a combination of dysglycemia, hypertension, hyperlipidemia, increasing the risk of cardiovascular disease. So the added benefit is cardiovascular protection as well as improving the LUTs and the erectile function. Lots of work to do for these men.